I'm not supposed to touch anything, but I'm going to go ahead and do it.
See, I can't use that mic now.
Okay. We're live, by the way. If the media is ready, we'll go ahead and get started. Good afternoon, everyone. We are here this afternoon to provide you with an update on COVID-19 as it relates to our community, the city of Dothan and Houston County. Kind of give you an update with where we are. Would like to, I'm going to speak first and give you just a general idea of what we've been working on as of late. And Chairman Culver will follow up with some more information as well. What I would like to do first is to tell you that as we have continued to progress in our dealings with COVID-19, I want to say first off a thank you to both hospital groups. Corey Kirkland with Alabama Department of Public Health, EMA, Chairman Culver, and our city manager and staff here as well. They are working together very, very well, and I appreciate it first and foremost. As again, there's no playbook for this. This is a pandemic. No one, I don't think, at this point has been through this before. We recognize that there are two issues that hospitals are facing across the country, and as well as here. That would be staffing issues, and that would be capacity issues, the ability to be able to take on more and more patients. I think this is important to keep in mind because, first off, we are an area that takes in about 10 counties that typically handles for those 10 counties trauma, cardiac, and stroke victims as well. And so we have a lot of people that come to our area. We gather some people from Georgia and Florida as well that come to our hospitals. And they come to our hospitals for those incidents and things that are going on in their lives. And we want to continue to take care of them because they are your family. They are your friends. They are those that you know every day. When you throw on top of a pandemic like COVID-19 and a virus that so far continues to baffle all scientists and the medical profession across the board, it is a challenge. And so it is continuing to increasingly stress and strain staffing and capacity and space, the ability to continue to take care of those in our community. I think that's what you need to hear and understand and know today, that the things that we will be reminding you of are directly affect those two things, the staffing, the ability to take care of you, and the capacity to do so. I want to thank our group. We have a pandemic operational group that gets together, and they have gotten together over the last few days. We were asked to do some forward thinking and be proactive in what we do, and I want to just mention those that were a part of that group: Southeast Health, Alabama Department of Public Health, Dothan Communications, Houston County EMA, Dothan Fire Department, E911, the city represented by our Assistant City Manager, Flowers Hospital, and Pilcher Ambulance. And they have gotten together and they had challenged us to come up with some alternate care site as a part of that plan to be prepared. We would hope that is the very, very last lever that would ever have to be pulled, would be an alternate care site. It is by far easier and better to treat those on site as far as staffing goes and as far as the capacity to do so. But we've pulled that group together. They've done a tremendous job in a very short time, and we have that paperwork in place. And if it ever gets to that point, we will have that part of our surge capacity plan in place. And so I want to thank that group because they did a tremendous job in pulling all of that together. Again, I want to tell you that wearing face masks, cloth coverings, sanitizing, physical distancing when you're in public helps us to take care of one another. And so I want to yield the mic to Chairman Culver and ask him to cover a few of the items as well. Chairman Culver?
Well, he just said what I was going to tell you, so I'll just take questions. No, just kidding. This is a very serious time we live in. Y'all all know I've been doing this, some of you may say too long, but we've never experienced a time like this, where we can't plan for what's going to happen 2 weeks from now because we don't know what's going to happen 2 weeks from now. It makes it extremely hard on our citizens. It makes it hard on government. But one of the more difficult things to me is it makes it hard on socially and on our citizens as they have relations with each other. I'm seeing a lot of real tense communications, a lot of real tense relations out there. And you know, folks, we need to think about what's going on here. Okay, you want me to take my mask off? I'm not. We need to take care of each other. We need to think about our loved ones. We may feel, some of us out there may feel that, you know, all those numbers out there are wrong. This is all some devised effort by somebody off in Washington or somewhere. But if you go with some of these folks when they leave here, they can show you family members who don't really care what those numbers say. They can show you family members who are sick and dying. We need to care about those people. I don't think it's too much to ask to wear a mask, if not for you, for the family members of all those folks in our hospitals that Mark just talked about. We're not asking much. The governor's not asking much. We think we need to take every step possible to keep our people safe. That's all we're asking you to do. The governor's order runs out next week. We don't know what she's going to do. I'm expecting, I think we're all expecting possibly some changes. Certainly we think it'll be extended. I think most of you saw this morning where the ABC board tightened up some requirements on alcoholic beverages being served. I think that might help. I think that was actually a compromise between two different requests. We do want people to continue to wear a mask. We do want you to social distance. We want you to continue to sanitize. We would like to encourage businesses out there to adopt a policy of not allowing people into your business unless they have masks. A lot of the larger places have. We think that's a good practice. The governor's order currently says we have to wear masks. Not everybody is going by that. We would encourage businesses to pick up the mantra and say you don't allow anyone in your facility unless they're wearing a mask. To me, the numbers that people argue about don't matter. It really doesn't matter. When you can walk out there, I would dare say if I asked y'all to raise your hand, everybody in here knows somebody that's been sick. If we'd asked you that at our last press conference, which was about a month ago, that probably wouldn't have been the case. It's out there. We all know about it. Let's do our part. Let's do it right. And to me, most importantly, let's be kind to each other. Let's do this thing and get it over with and get on about our lives. You can't do it, though, unless you do the right thing. That's all Mark and I are asking in the community and the hospitals. These guys are facing critical issues. Let's help them get past that. Mark?
We'll open up for some questions. I think I did fail to mention that our nursing homes as well have been hit hard, and they are the most vulnerable, and so that's a concern as well. And so, you know, we need to keep that on our mind as well. That those are those that are having to be taken there. It's a large number. It has changed in 2 weeks, drastically changed in 2 weeks, and so we just want you to be careful and cautious out there. We'll be glad to take some questions at this time, and if it's above our pay grade, we have medical staff here as well from, and doesn't take much to answer some questions. Yes, sir.
This one you can answer. Both of you can answer. The consistency in what you say when you're here is a message that's going out, but there's another message going out when people see folks at ballparks having ball tournaments like this last weekend. Hundreds of people from all over the place. No social distance, no mask, no nothing. And I was told that there were folks working out on the roundabout last week, county employees, who were not wearing masks, but the city folks that were working out there were. So how do we deal with these inconsistencies in policy?
Well, I'll take a shot at it if you don't mind, and if you could join in. I was watching the media fire away at President Trump the other day and quizzing him down because he didn't want to wear a mask, and then he's wearing a mask, and then somebody caught him out somewhere and he didn't have his mask on, and I thought, good heavens, how do you live like that when people are scrutinizing you on every hour of every day? I think the way I would answer that is if more of us would on a consistent basis try to practice this. It's not going to take much. If you're out in public, you wear it. You're going to see people that choose not to. I was across the border, not the border, Florida line, excuse me. I didn't go that far. Across the line, and there was hardly anybody wearing a mask at that particular, the place where I was. But that didn't make it right. I think that the message is, the one thing that they all agree on is that the face mask coverings and sanitizing and physical distance works. It helps to limit that number. Yeah, is somebody going to be out there and you're going to catch somebody that's not doing it when they should be? Absolutely. It's just part of human nature. But the more we can do it, I think the better off we'll be and our hospitals will be. That's the biggest thing to me is the more you do it, the more I do it, the more we all do it, the better off we'll be able to take care of our family and our friends and our community.
You didn't want me to address that? You don't want me to answer his question?
I apologize.
That's all right. Let me just tell you real quick. We adopted a policy when the governor did her last order. I don't know what the city's policy is. The city manager might can answer. And it's in writing. And we expect all of our employees to honor it. If they're inside at their desk, they can take their mask off. If they walk down the hall to see somebody, they put that mask on. If they're in the truck with anybody at all other than themselves, they wear a mask. If they're out working on the road and they're not, they don't have to wear the mask if they're in open air. Hopefully what you saw or somebody saw, they were not right up against each other, but that's the policy. We're taking a pretty aggressive position that we want our employees and the people coming in our buildings to wear masks.
As well, the city has, because we want to protect our employees. And so we hope that if they're riding together, that they're wearing masks. That's our intention as well. Mr. Curtis?
From your perspective, you and I have talked about this previously. How more serious are people taking this now than they did then? Are they still
You know, that's a tough one because this gets to be a very polarized issue, I think for all the wrong reasons. I think it can be something that brings us together in unity, caring for one another, even if you don't like to wear a mask, even if you don't want to, even if you don't want to physically distance. It's just not the issue. The issue is, you know, do you sacrifice something that you may not like to do because it just might help someone else in the community? And I think that would be my perspective and my message. I think that we, you know, everyone that suffers from COVID fatigue, they're tired of being out of the normal way that they can live their lives, and it's stressful and it's a strain on they and their families, and we've suffered from, in some ways, with our economy, and we're continuing to try to battle that. And so, I hate to comment that we're doing better or we're not doing better. I would just hopefully encourage all of us to continue, as Chairman Culver said, to be kind to one another and try to understand where we are. And let's just get through this the best we can until they come up with medicines and vaccines, and we can continue to fight it. We do have flu season coming, and that's a concern as well.
I have two more questions, that's all. One would be for representatives of the local hospitals, the other would be for the person, and then I'll let you know. Whoever would like to. Okay. You cannot speak for Flowers. So
Right, they're here.
Flowers is here. Yeah, but, then my question is just simply, how much of capacity are we on our beds that we need for patients who suffer from this, the ICU type concern? Are we gonna run out? I don't know how to ask this question.
Okay, well, I'll try. I don't know the answer to your second question. I don't believe so. I don't believe we're going to run out. I think what the big difference, you know, we closed down both hospitals closed down pretty significantly at the beginning. Stopped elective procedures, stopped doing some diagnostic procedures on patients that we quotes were healthy at the time, to try to handle COVID. And the result of that, the delays in care had a huge consequence. People putting off something that could have been done at an earlier time when they were healthier. Now they're further down in the process and they're sick when they come in. We saw people not coming to the emergency room because we were sending out this message that COVID was at the hospital, so they didn't want to expose themselves. So what we learned from that when we reopened was that, you know, we have a service to provide regardless of COVID that is important, and we've got to figure out a way to do both. And I think we've gotten much better at that. So we're continuing to do the normal things that we do, plus COVID. And the key to this is this curve of how is COVID coming into the community, and that's what we've watched the most carefully. If we can keep that rate of inpatients to a level that is manageable, then we'll be fine. And so far, we've been able to do that at both hospitals. It's been stressful, but we're doing that. We came to the county and the city specifically to ask what happens if we get beyond our capacity. Who else can help us, and where else can we go if we need to? We hope we don't have to do that, and so far we don't. We're managing this, but it's stressful. There's no question about it. It's stressful.
So based upon what you know today, and I understand you don't know tomorrow what's going to happen, you think there is adequate beds at those hospitals to
Yes.
accommodate?
Yeah, I think the biggest strain right now for us is critical care. Have we been off critical care diversion? We've been on critical care diversion for over a week, I think. And so we're struggling internally. We're trying to expand critical care coverage. And a lot of that is not physical plant. That's people who know how to take care of critically ill patients. That's been the biggest strain for us, and we're looking at alternatives on how to expand our critical care capability and manage those patients. We don't like being on critical care diversion. because it's not good for the community, especially if both hospitals are in critical care diversion, then there really isn't any. That just means we're both at capacity. So that's been the biggest struggle for us, but we think we're going to be able to manage that internally.
I think we've had 60-something cases in Houston County, is that right, yesterday, today, somewhere in that neighborhood. But the biggest problem area now seems to be up in Dale County. And I asked that to ask this, you know, there are so many people coming in from Dale County into this community. Just your assessment of that situation where that seems to be perhaps the hottest bed of activity in this part of the state.
Well, I'll be honest with you, I have not looked at the number. First thing this morning, we were, of course, working with the hospitals and different things. But throughout the last few months, we've seen different counties become hot spots. I mean, we know from time to time we will have additional cases in our nursing homes. We've seen additional cases from reports from weddings and funerals. I think the biggest thing is that we have community-wide spread, and we're going to see it pop up in our nursing homes, but we're also going to see it as a result of our workplaces, of our activities outside of work, at home. We know that when we have test sites, we have a lot of people that come through and they're anxious and they want to get back to work. And we're telling them, you've got to go home. You've been tested. You need to go home and wait for results. So we have a lot of people, I think, with a lot of different ideas about how to manage this once you're tested. We need a lot of adherence to the mask wearing, but also, as I said, the distancing and the staying at home, the hygiene, all those things working together. I don't know that there's any one magic bullet, unless that we could point to one specific entity that does have a large number of increases. We've worked with a lot of food processors as well too. We know from time to time we'll have a spike there. At the same time, you can have a spike in a nursing home, and then you can just incorporate any community transmission that you have going on too. And for a certain amount of time, you can have a county become a hot spot. It could also be a large event. It could be something out of a church. It could be something at a ball game or something like that that would spike that. I don't know of anything specific to Dale County. I know what we see from week to week with our testing and with complaints and things that come in. We know that have some restaurants from time to time that do a good job and some that don't with mask wearing, but that's also a lot of other businesses. Again, we have some food processors that just due to the fact, and some other businesses due to the fact the type of work they do, they're going to be in close contact. The ones that we've all tried to work with, I think, are honestly doing their best to mitigate that inside the workspace. They're testing them, they're wearing masks, they're doing all the barriers and things they can do. It's really important, though, when we leave work that we, as we said at the meeting the other day, we keep a close circle. I think it's important that, especially with nursing homes, if you work in one, when you leave there, it's critically important what you do when you leave, wearing a mask, your hygiene, maybe not going to certain stores if they're not doing a good job. I mean, just little things like that to keep you well, so that when you go back to your workplace, you stay well. There's going to be a lot of things, I think, that contribute to this. And with ball games and things coming on, we're going to see some spikes in different places.
And obviously, we've all been witness to this, but when we were back in March and April, if we shut down some businesses for a while, it would get better. And then if we would do that, it would get better. And if we would open up at 50% capacity, it would be better. And if we did this and we wore masks, frankly, it's not got any better. I understand you don't control that, but do you have any sense of when it will get better?
We could all put our heads together on that one. I really don't. I think the important thing for us to remember right now is that we have some good common sense guidelines that we can go by. Number one, wear your mask. When you're in public, wear your mask. Washing your hands, good hygiene practices, your social distancing. All of those things will contribute to making this end sooner. I'll have to leave the vaccines and the other things to the people that know more about them. But the best thing that we can all do, businesses, the public, everyone, wear your mask, social distance, stay at home as much as you can, keep a close circle. All those things will contribute to making this go away sooner.
Go ahead.
You know, we get them from all the different counties. I don't have one report that I get that tells me, you know, where the majority are of them right now. I would have to go back to our database to try and see where they are. It's going to vary from 1 week, from 1 month to the next.
I have one question, and maybe the hospital, because I got phone calls the other day of a person that was on their deathbed, and the family wanted to go see them. And I know how hard it was when my grandson was in the hospital. It took all I could to keep from showing Ricky Stokes and getting in there to see him. So, what do you say to the families whose loved ones is in the hospital in bad shape and you don't let them in? You can answer that, so they call me.
Yeah.
Who do we call?
Yeah, that's a tough one. First of all, if we know of somebody that's at that point where they're dying, then we have a kind of a different approach to them. But it's still, you know, at the end of the day, we've got to be able to protect the people who are taking care of those patients. And that's the critical piece to us about why we've restricted visitation, because if you bring it into the hospital and you expose personnel to COVID, and then we don't have those personnel to take care of the next sick patient that comes in, we've got a real problem. So we're trying to balance between the two. We've looked at social media to try to help. You know, are there ways where we can do that? I don't have a good answer for you, because it's not going to be what people are used to doing, where you know, the whole family gathers in the room. That's just not going to happen during this pandemic. But we do ease up the, you know, single visitor policy when we know somebody is in that condition. That's the best we can do at this point.
Any other questions? All right. Well, I want to thank everyone for being here again today. This is tough times. It's a tough question, but it's part of where we are.
You mentioned that if we do have a surge in cases, you guys have a plan in place as to where hospitals and everybody will be bringing patients. Where is that?
So in our report that this put together earlier, we have identified 3 different places that we would have for alternate care sites, and that would be the eye surgery center. And the second would be the Surgery Center South, which is right next door to it. And then last would be Westgate Gym. It's been set up in the past for hurricane evacuations. It's been meets a lot of the EMA and FEMA's precautions and things that we need to do. So those would be the 3 sites that we'll be submitting as we move forward. If we ever get to that point, it will not only be a space issue again, it will be a staffing issue first and foremost, and then we are really going to be in a dire situation at that point. We don't want to get to there. That's not where we want to be, and so we want to do everything we can to encourage people that we're not going to be there.
Do you think a city shutdown would happen before we got to that point?
Well, the city, we're going to continue to follow the Alabama Department of Public Health and the governor's recommendations. They're who we answer to, and we will continue to do that for the time being. Again, this is tough times. I was, you know, Ricky's question about seeing a loved one in the hospital, and you ride by some of these, you know, churches, and I see funerals where there's only the hearse and, you know, 1 or 2 cars out there, and it's sad, and it saddens in my heart to see, you know, that weddings that are small and people can't get together. We want to do what's right for one another. So I'm appealing to you to do that today. We don't want to shut down businesses. I'm not going to. It's vitally important that we continue to work, and it's vitally important that we continue to try to have our children to do the things that they want to do. We've got some tough situations that are coming up. You have school that's coming up before long. We have the flu season that'll be upon us as well. And so let's just continue to try to be one community taking care of one another. Thank you again for being here, and thank you for the media for being in our press conference. Thank you.